By now you've heard the news. Dr. Casey Means has been nominated as the new Surgeon General by President Donald Trump. It's not without controversy among the media. I went to Twitter to see what folks on Twitter were saying. One pundit, who is a political commentator, said Dr. Casey Means is a lunatic who will do serious damage to public health. Now, it's interesting to just compare previous Surgeon Generals to the present nomination. So Vivek Murthy was the previous Surgeon General who was nominated by Joe Biden. Now, you might remember he was featured on the media in various Senate hearings wearing not one, but two facial coverings after receiving all of his immunizations, yet he's still wearing two masks, right? So on the one hand, Dr. Casey Means is being characterized as a conspiracy theorist who hugs trees, participates in full moon ceremonies, promotes shrines, and psychedelic mushroom trips. This is according to the Irish Star. So there's this smear campaign against Dr. Casey Means. Now, as you might know, she's the author of Good Energy, and she has been promoting all aspects of metabolic health for a long time, helping people better understand how diet, nutrition, exercise, stress, consumption of ultra-processed foods contribute to the decline in metabolic health, which, lest I remind you, our own data from the NHANES data set shows that about 93.6% of US adults have some degree of poor metabolic health. So this is obviously a very prominent issue. Now, when we're comparing and contrasting Dr. Casey Means to Vivek Murthy, you might want to understand, the different vantage points. No one really criticized Dr. Vivek for getting $2 million for speaking about pandemic responses and receiving tons of money from pharmaceutical organizations and beyond. He was also well known to promote the use of booster shots for children, which, as many of you know, were largely immune to serious effects from the actual virus, yet there was, of course, unintended harms associated with the prophylactic solutions that were tested on all of 8 mice. We're talking about the booster campaign that rolled out in 2022. So I think it's important to just compare and contrast here is some of the responses. But let's look at, this is MSNBC. Dr. Casey Means, Trump's new Surgeon General nominee, draws unflattering scrutiny. Given her background, the confirmation hearings for the president's new Surgeon General nominee are bound to be contentious. Right? Anyone who threatens the establishment is going to get painted as a conspiracy theorist, QAnon supporting anti-science heretic. Now, it's really interesting, but when we actually look at the track record of these individuals and what they've said on various interviews or podcasts for their own videos, she's being characterized as someone who's just a money grabber, who's going after, the wellness industry because she had a company called Levels that used the Abbott technology for a continuous glucose monitor, the Freestyle Libre. She has a book. I mean, all these things are fine. People can have their products and their services. Many people who have been in politics or positions of health often come from industry. This is not, abnormal. So I understand some people are concerned with that. But when we look at Rochelle Walensky, or we look at Gottlieb and all these folks who have ties with industry, and they're put in a position of public health. So let's hear what MSNBC has to say. They said, Means, who received an undergraduate degree in medical degrees from Stanford University, has held research positions at the National Institutes of Health, New York University, and Oregon Health and Science University. She is a proponent of metabolic health when your body processes food in a way that keeps your blood sugar, blood pressure, cholesterol, triglyceride, and weight within healthy ranges. All of which sounds pretty normal, right? The tenets that she's promoting with regards to metabolic health are really helping people take their own agency to optimizing this critically important system in our body known as our metabolism, which, as I mentioned, about 93.6% of US adults and even a higher percentage of men over the age of 50 have some degree of insulin resistance and increased adiposity and hypertriglyceridemia and beyond. So this is a really important issue that I think a Surgeon General should understand, what are the ways that we can optimize this? Because, when it comes to deaths from infectious disease, they contribute to an ultra small minority of the health expenditures and morbidity in this country. We talk about cancer, cardiovascular disease, Alzheimer's disease, dementia, ADD, mental health issues, autoimmunity. I mean, these are by and large the bulk of the medical allocations and expenditures and reasons why people have morbidity and mortality. And a lot of that is from inactivity and poor dietary choices. So the report goes on to say, while U.S. surgeons general tend to have extensive expertise in medicine and public health, Means was described by the Associated Press as a wellness influencer who dropped out of her surgical residency program and has no experience in public health administration. The same report noted that Means has supplemented her income by selling dietary supplements, creams, teas, and other products sponsored on her social media accounts. The Wall Street Journal reported that Means' political profile received a significant boost after she taped interviews with conservative commentator Tucker Carlson and podcaster Joe Rogan. Come on now. People on both sides of the political spectrum. I mean, it's crazy that we paint people into these pictures of being ultra left or ultra right just because they were on someone's podcast, and therefore anything they say is invalid. It's really a shame that anyone who goes on the Joe Rogan podcast or Tucker Carlson podcast is suddenly a conspiracy theorist. I mean, that's not fair. The same article added that Means' newsletter offers a mixture of practical health advice, exercises to boost blood flow. Oh my gosh, how terrible. She's promoting exercises to boost blood flow. In the broader takes, when we fight the natural cycles we exploit. She has taken some positions, such as raw milk, at odds with public health officials. Here we go again. The mainstream media, anytime anyone promotes a consumption of unpasteurized milk, that suddenly puts them into the position of being a conspiracy theorist. But humans have been consuming raw dairy for at least 10,000 years, my friends. Now, I know that statistically speaking, there's a higher number of outbreaks with, raw dairy compared to pasteurized dairy. But there is a large swath of the population. If you've ever been to the state of California, you can go to high-end grocery stores and buy raw milk and raw cream and raw yogurt and raw kefir. And people are not just dropping in the streets from consuming these products, my friends. It's benefiting their health because the homogenization and ultra-pasteurization processes change some of the structural proteins within the dairy products that can cause indigestion and other issues. And we do have epidemiological data finding that people that consume raw, unpasteurized farm milk actually benefit from that and have a lower prevalence of atopy and allergies, especially children. So again, there's gray area here. There's nuance that should be talked about. But here we go from MSNBC. We get to the conspiracies. As far as her approaches to vaccines, the New York Times reported Dr. Means has echoed some of Dr. Kennedy's skepticism of vaccines, calling on the new administration to study their cumulative effects and to weaken liability protections offered to vaccine makers. What's wrong with that? Shouldn't a manufacturer of a product be held liable if people have unintended harms from taking that product? I mean, this is heresy that we're in a state here where there is no recourse. If you have an unintended harm from an injection, there's no recourse for you. Sorry, you have cerebral palsy, or you have memory loss, or neuropathy, or sudden cardiac death, or congestive heart failure. Oop, sorry, there's nothing you can do. I know that you were told that this was safe and effective, but there's no recourse. What product out there is there besides this product that we're talking about that we can't even name on these platforms is made? So imagine if you bought a car, a brand new car. Imagine if something happens with that car structurally and you get into a major accident and someone gets critically injured or even dies. You could sue that car manufacturer, right? We know that, but in this case, we can't really do anything. And so I think it's just, there should be a way to reevaluate the liability protections. Okay, so I don't see how that's a conspiracy theory or an anti-science theory. We should be looking at this. Okay, this is a Senate-confirmed position, the article goes on to say, and I'm going to climb out on a limb and say that her confirmation hearings will inevitably be the most contentious of any Surgeon General nominee ever. Okay, so I think that's not outside of the realm of possibility. We saw what happened with the RFK hearings and beyond. I think there's definitely going to be a partisan divide here. And it will be really interesting to see what they can dig up and what they say and if there's any credence for these accusations and beyond. But in my opinion, I think this is a really good thing. Having someone who understands the importance of metabolic health, being in a position to influence the health of the American people, which are experiencing a pandemic in and of itself, an epidemic of cardiometabolic disease and chronic disease. And clearly the direction of health in this country is going in the wrong direction. And I think you probably agree with that. If you do, please hit that like button. Let me know what you think in the comment section below. And for fun, let's get into some of the other so-called conspiracy theory accusations here. This was from The Independent. The title here is Trump's picks conspiracy theorist wellness influencer Dr. Casey Means with no medical license to replace Fox contributor as Surgeon General. And on this particular piece, there's a picture of a Abbott Freestyle Libre glucose monitor, as though her contributions for helping people have more agency over their metabolic health is somehow in conflicts with her ability to be a Surgeon General and help influence people's nutrition and lifestyle choices. It's absolutely crazy, my friends. What do you think? Let me know in the comment section below. And thanks for tuning all the way in. If you want to optimize and support your metabolic health, you can go to myoscience.com and save on the new Berberine fasting accelerator that features one of the most effective berberine raw materials in the world, known as Himaberb, because this berberine is wild crafted and hand harvested in the Himalayas. Berberine has a unique ability to optimize gut hormones and metabolic health, and helping with waist circumference and even curbing food cravings. So if you suffer, like me, from wanting sweets in the evening time, maybe cookies or some ice cream after dinner, I would recommend taking 2 to 3 capsules of the novel Berberine Fasting Accelerator before dinner time, and notice how it affects those evening food cravings. You can save by going to myoscience.com and use the code podcast at checkout. We'll catch you in a future video down the road.